Oh,
Thank you, Scott. Welcome, everybody. So glad you're with us tonight. As Scott mentioned, we usually do start with a little bit introduction of a little educational piece, and I usually kind of derive that from what's kind of in the ether around me on any given day or week. And I've been working a lot with the clients in LA this week, and been talking a lot about triggers and what to do with them, and kind of our first response to deal with them. So I just kind of wanted to review that a little bit, just to kind of remind people of what we're dealing with. And we talk about two different kinds of triggers, I think. One being the external triggers, right? Those are in famous expression in program, people, places, and things. Of course, all of those can be a trigger for us. The people we may have used with or think about or fantasize about, the people that we have some history with. But it can be other people too. It can be our boss. It can be employees. It can be employers. It can be coworkers. It can be affair partners. It can be all these people that may not be in a sexual relationship or an intimate relationship, but they can trigger us in our feelings in such a way that we want to act out. And so I think it's important to kind of be aware of those kind of people in our universe and limit exposure to them, which is hard in recovery sometimes, because sometimes we don't have a lot of connection, and it feels like a little bit of a grief and loss to let go of somebody that may not be the best person for us at that moment. So these are some of the hard choices we have to make. Other kinds of triggers, places. Again, people don't often think about this, but with these intensity addictions like sex and porn and chemsex, dopamine is the neurotransmitter of note here, the star, and dopamine is really good at kind of gluing things together. So when we get high and have sex, at a bathhouse is going to trigger us, right? Or it may be a parking lot, or it may be a strip club, or it may be a bar, or it may be our own home, or a neighborhood, or a city, a street, all these things. I remember a guy talking about having to drive down a street past the motel where he used to meet his affair partner. So every day he was kind of triggered a little bit until it finally just kind of wore off, or he changed routes. But anyway, places can be really powerful. Events, meeting new people, going out, even stuff, again, that's not necessarily triggering, but times after work. How many people partied maybe after work? So they may start to get triggered around 4 as the end of the workday approaches, or Friday nights, or Saturday nights. Those weekend nights for sex addicts and porn addicts and chemsex addicts are really difficult sometimes, because that's when I was reminded of that great expression, FOMO, right? Fear of missing out. People are afraid they're going to miss something wonderful. Or it could be other kinds of things, holidays, right? Thanksgiving, Christmas, where there's typically a lot of tension and stress. It can be after an argument. It can be after paying bills. It can be all kinds of different events. Certain objects. With these addictions, sex, porn, and chemsex, we get highly visually sensitive. And so we get highly attuned to visual stimuli, whether it's a person on the street, an image in a magazine, or on Facebook, or anywhere. Other things, objects, our ATM card, our phones, which are now probably the biggest single companion to our sex addiction, right? With all the apps and the communication objects on there. And finally, behaviors can be external triggers. Being home alone, being home with friends. It doesn't matter. It could be home with or without. After an argument, and so on. Those are kinds of things that are external triggers. And by and large, the thing we always emphasize about triggers is we need to avoid them if we can, right? So when we have friends that are not the best influence for us, we may want to suggest that we distance ourselves from them. So we're trying to avoid those triggers. We can't always avoid them. And so when we can't, we need to quickly diffuse them. So that's really the strategy, I think, to deal with some of these is avoid, if possible. And if it does happen to occur, diffuse. And the way I really recommend diffusing those is first, without thinking, take an action, make a connection with someone, open a channel, as we talked about in group today, open a channel with somebody so you can connect with them. Don't stop and try to figure out, why is this happening? I think most addicts, including myself, we go up into our heads and like, oh, what just happened? Why is that going on now? And we try to start to figure it out. Meanwhile, we're losing precious time to get rid of that trigger. And so I think to really be able to diffuse it in an effective way by distracting ourselves, by making a call, by taking action of some kind, and by talking about it and sharing it, giving it away, really does help. So I want to just quickly go to the internal triggers, right? So those are the things outside ourselves. What about things inside us? So internal triggers can be different kinds of feeling states. So negative feelings are the ones most people think about. If we're anxious, if we're angry, if we're sad or lonely or depressed, or feeling overwhelmed, or feeling ashamed, or feeling inadequate, all of those things are kind of an inside job that we generate internally based on stuff going around us outside, but it still comes from within. And a lot of that has to do with how we frame things, our core beliefs, the self-talk, the negative self-talk, the negative beliefs about ourselves. So that's where a lot of the deeper work, I think, of recovery and perhaps therapy really plays a role, because we have to dig a little deeper for these internal cues to really kind of, first of all, identify them when they bubble up, and they will for a while, but then start to do that deeper work that will maybe keep them from bubbling up quite so often. But just like with the external triggers, I think it's important to mention that it's not just the negative stuff, positive feelings too. There's those, a couple of years ago, there was a really wonderful assessment of stress, and they assigned points to the most stressful events people can experience, right? And of course, you think, the loss of a husband or wife, or the loss of a child, or even retirement, all these losses. But actually, at the top of the list for stressful events were happy events, weddings, graduations, all these things that we should be celebrating and happy about can be equally stressful. The birth of a child, incredibly stressful in the family. So it's just to be aware that something can be good, but it still can be kind of triggering and stressful for us. So I would say positive feelings, right? Like being excited can be a trigger for people. But by the way, being excited is in our bodies very similar to kind of fight or flight, or the intensity, or that preoccupation of those addictive states. That's all the same kind of chemicals going on. So excitement about a happy, wonderful thing can mimic that and make us be a little triggering. Feeling passionate, feeling confident, feeling aroused, all this positive stuff. And then I was recently introduced to this other way of not just having a spot, black and white, bad feelings or good feelings, but a third category that is called normal feelings, as a way of not judging. And what are normal feelings? Being bored, being nervous, feeling tired, feeling lonely, being embarrassed. These are kind of common everyday things that aren't tragic, but they can really, if we're feeling vulnerable, if our emotional bandwidth is kind of reduced for whatever reason, they can really have an impact on how sensitive we are. And if we're in any way, if our bandwidth is reduced, so are our tools. And that's when I think some of these things can really have more power in terms of starting a trigger for a relapse if we're not careful. So that's kind of a really quick survey of different kinds of triggers and cues we have, and some quick ways to deal with them. But the thing is, I think awareness, that's the bottom line for all of this stuff, to manage and get on top of it. I think that's it for me. Thanks.
Thank you, David. Type your questions into the Q&A about triggers or any other aspect of addiction and recovery. And I see we've got one in there, but I have a bunch of things that I sort of want to bring up here. Really what I want to bring up, I'm going to share my screen real quick. Hopefully. I think it's somewhat important to place triggers in context in terms of the cycle of addiction.
Yes.
And up here at the top, we have the triggers. And when we feel triggered, sex addicts, this is the sex addict cycle of addiction developed by Dr. Rob. We go into fantasy and ritualization, where we start thinking about sexual encounters and past sexual encounters, and we start taking steps toward acting out. And this is actually the high of sex addiction. These are stages for substance abuse addiction, but this is the high of sex addiction, because when we're in this fantasy and ritualization, our brain is responding as if we're already using and acting out. And most importantly, we're escaping our world. We're not feeling the trigger anymore. Triggers, they can be good things, but normally they're unpleasant. And even the good things like weddings and Christmas, it's the trigger is the stress and the anxiety and the expectations on these events. So it's the not fun parts of these events, because we put so much pressure on ourselves to have fun. So we've escaped that when we're in fantasy and ritualization. And then acting out with drugs is, of course, using, and we get high and we stay high for, anywhere from 5 minutes with cocaine to, all day with meth, depending on what we're doing. David can fill in with that if he wants to. But with sex, it's masturbation, or it's, looking at porn. We can call looking at porn ritualization, and the masturbation part of it acting out, or it's picking up. But once we have the orgasm, everything comes to a screeching halt for the sex addict. Whereas a substance addicts can just do more and get high. And then we go around to numbing and despair, and we end up back at triggers. So I just wanted to put triggers in context, why this discussion today is so important. David, did you have anything you wanted to add about the triggers or the cycle? Or?
No, I think that's great. And I think you're absolutely right. So dopamine, that is the high while we're in that preoccupation stage. And dopamine really stops doing its work once we have an orgasm. So yeah, we're back to kind of normal at that point. But definitely, it's true. Yeah, like it.
Yeah, and then, when you were talking about triggers, I always think my biggest trigger, even to this day, is boredom. And that should be no surprise, because I have an intensity addiction. Boredom, I do not want to feel boredom.
And I just want to underscore that, Scott, that's such a huge point for sex addicts, porn addicts, and chemsex addicts. It's all about the intensity as a way to escape and kind of distract. And boy, if that intensity is gone, especially in recovery, early recovery, suddenly we're feeling feelings and very uncomfortable. So boredom is a huge trigger.
Yeah, boredom causes me then to feel lonely and anxious and all the other things, but it starts with boredom. And then you talked about how to combat these, and you talked about normal feelings like boredom and things like that. My favorite tool for combating normal feelings is HALT: hungry, angry, lonely, tired. When is the last time I ate? Am I angry or anxious? Am I lonely? Would a 5-minute phone conversation fix this? Probably. Or I'm tired, can I just take a little cat nap and will I feel better? Or just sit in a chair and be quiet for 5 minutes? Will that fix this? 9 times out of 10, these normal emotions can be fixed really quickly and easily with a sandwich or a little rest or a chat with somebody. So that's a quick check-in that people can do when they feel triggered and they're not sure why. Just do the hungry, angry / anxious, lonely, tired, HALT. And I also, I want to, David mentioned opening a channel. I also, if you're the sex addict, rather than the partner, and you're struggling, you're feeling triggered, it helps to have a copy of your circle plan with you, your sobriety plan, because the outer circle stuff, the healthy behaviors, are things we can do when we feel triggered. That's how we define them when we teach you what the outer circle is. These are healthy things we can do instead of acting out. So these are things we can do to stop the cycle before we act out, is all the healthy stuff. And I actually I'm old enough that we didn't have phones like this where I could keep a digital copy. So I had a printed out, tiny printed out copy folded in my wallet. And I had it with me at all times with a $20 bill. So that I could, pay for coffee if I was going to go have coffee, or I could pay for the movie if I was going to go to the movie, or, whatever I was doing to avoid acting out, I'd have $20 to pay for it. So that was important. And then I also think it's important, since I brought up the cycle, I feel like I'm taking over here, sorry, is to talk about where we can intervene in the cycle, where it's easy to intervene and where it's not easy. And the analogy I always use is, we've got a really steep hill and there's a big boulder at the top of it, and it's just kind of perched up there. And it's on there pretty good until we get triggered, and then it starts to do this. And we can shore it up real quick by, taking a contrary action and keep it steady, or we can kind of just watch it. And if we keep watching it, it's going to go. And then there's nothing we can do. Once we're like deep into fantasy and ritualization, we're going to act out. Unless there's external intervention, we're going to act out. So again, it's so important to recognize our triggers so that we can intervene before they kick our butt.
Totally.
No.
Totally.
Okay.
Beautiful.
I'm talked out. Let's go to some
Well, let's go to
questions.
some questions.
All right. I have a core belief of compassion, family, connection. My sex-addicted ex-long-distance partner made the choice to not meet my needs, stop long distance, and get specialized help for couples. So we ended our relationship 2 months ago. We communicated a few weeks ago as I reached out when his dad passed away, and now his mom is in the final days of her life. Any suggestions on how I can remain authentic to who I am, but not give more than I get back in this situation? So, good question.
Yeah, so interesting question. I think really what we're talking about here is boundaries, right? And how to keep the interactions healthy for us. But this is someone, you know, that you have a relationship with or had a relationship with, and you know, you express your own values of compassion and family and connection and you know, human kindness, it sounds like. And I think even if I'm having problems with someone, if their parent has died or if a parent is dying, I think I would reach out. So I think what you did is a kind thing. I think in that case, if it were me, I would reach out, as make that connections, but kind of with no expectations, with just kind of expressing my condolences, my sincere, you know, sorrow for that person and the pain they must be experiencing. I'd embrace a little empathy there, and then, you know, that's all. I think so. I think that is true to who you are in an authentic way. It expresses compassion for the person that you had a relationship with and cared about, and that's some of them probably still care about. And so I think it comes down to boundaries. And I think I would suggest kind of being really firm and not having a lot of communication. But when you do, I wouldn't expect much in return. I'd be expressing your condolences and not really put too much more on it. And I don't think I would, given the history, I don't know that I would go deeper than that or make yourself more vulnerable. I think when we go out on a limb, you know, with expectations, we can end up getting burned. And I think I would keep it to the degree you're comfortable with, but with no expectations, with really clear boundaries about going too far.
Yeah, I completely agree. I mean, don't get on a plane and you know, help plan the funeral. You know, that's just no. You've done well. You know, this reminds me. I was talking to somebody about forgiveness the other day, and they thought, you know, if I forgive someone, then they're going to come back in my life and hurt me again, or they might. And my answer was no. Forgiveness does not mean you have to let them back in your life. Forgiveness is for ourselves. We kind of let go of the anger that we have toward them. But that doesn't mean we have to invite them back in our life and take more abuse or take more problems or whatever. This kind of feels like the same thing. I mean, it's not, but you know, you're doing the human thing and being compassionate, but you're not trying to get back together because it didn't work for you.
And I just really want to endorse what you've done here. You're talking about remaining true to yourself, right? And remaining authentic and taking care of yourself at the same time. And that's something that we need practice doing sometimes, but good for you. You know, you're doing it, and that's great. That's really healthy.
Yeah. Over the weekend, my sex addict of 3 years came to me and told me he was bored. How can I respond to him in a positive way and help him overcome his boredom without triggering him? I feel he blames me and resents me because I don't give in for him to go out and give it. Because I don't give in for him to go out and give into his addiction. I offer other things to do, family fun, movies, games, etc., and he shuts my ideas down.
Well, great comment. I'm going to go back to what Scott said earlier about boredom, and boredom is really a key trigger for people. But kind of the way you describe this, it sounds like the sex addict here is just kind of waiting to be entertained or wants things on his terms and is bored and kind of fix it. I think it's really important for the addict to take responsibility for themselves. And if they're feeling bored, they need to take some of the things we talked about before with taking an action, reach out, call, go to a meeting, attend something online. But I think this kind of feels a little victim-y here, you know, if he's kind of being a victim, like, oh, I'm bored, and it's not your job to fix that. And in fact, it sounds like you've made some nice alternatives. We talk about that outer circle stuff, right? These are healthy behaviors that give us dopamine and that reinforce our connections and make us feel better. And some of the family fun, movie games, oh, that's fine. It sounds a little bit like he has an agenda there. If that's not doing it, what he's kind of fishing for more exciting things, intense things to do. And I think that leads down a dangerous path. So, I think boredom is his problem, and you can help him by, I think, just setting clear boundaries and not overdoing it in terms of trying to help him out of his boredom state. That's what I would suggest. Again, boundaries. I can suggest he join you and your family for, social activities, which he has a choice to do or not.
Yeah, the kids and I are going to play Monopoly. You can join us or not. What you can't do is go act out. I picture myself babysitting my nieces and nephews, my sister's kids, and they're like 3 or 4 years old, and they're like, Uncle Scott, I'm bored. You want to play a game? No. Do you want to go for a walk? No. Do you want to play outside? No. You want to go to the park? No. And that was the game. Was they were just, and it was just like, oh God, and I feel for you. I mean, because there's nothing you can say that's going to be the right answer to him if he's in that mood. I mean, can this is a woman? Can she say, well, what's in your outer circle? Pick something. Can she say that? I mean, is that a
I think
reasonable
that would
thing
be
to do?
reasonable. Yeah, totally. Yeah, absolutely. And I think, but again, it's not your, not your job to fix it. You can point that out, but then I would carry on with your life and the games and stuff. Because Scott mentioned something that's the game is the back and forth, right? And so there's a dance. I call it a dance that people do, and this is an old dance that addicts and their spouses do, and it's a dance that you don't want to do anymore. And so I would encourage you not to kind of get involved in that back and forth, because it's going to be kind of 20 questions trying to fix it, and it's a little bit of attention seeking too, honestly.
Yeah. And I mean, for me, like, well, I'm out of suggestions. Maybe you should call your sponsor. I mean, I think that's a reasonable response too. His entertainment is not your responsibility. He's a grown up. So, yeah. As a partner, how much should I know about my husband's internal and external triggers? Great question.
I love that question. And, I think I encourage my clients to talk about this stuff with their partners. We talk about not disclosing a lot of really the harmful details, more the patterns and the disclosure piece. But I think these, and again, I think if it's too specific, I think that's just damaging as well. But we can certainly talk about these triggers in general terms. And I think it's important for our partners to understand those and support them and be aware. Because one of the dangers, I think, when we're being triggered is that we may not be onto it when it's starting to happen, and someone observing us might. So I think it's a really helpful, again, the partner's not responsible for naming these things and taking care of it, but I think it could only be helpful to give that feedback. I've had some clients who are really reluctant to share that, and I don't, and I'm talking about the circle plan as well. I think it's a good idea to make that known. That stuff isn't secret. The behavior, they might have tried to keep it secret, but with that kind of stuff, once you're in recovery, we need to name and keep it there and talk about it. I think it's only helpful.
Yeah, the trick with this is to share your triggers with your betrayed partner without blaming your betrayed partner for occasionally triggering you. So you have to generalize and say, well, when I feel less than or not good enough, when anybody says something that causes me to feel less than or not good enough, it sends me into a shame spiral that I want to escape. And, that makes me want to drink and get high and look at porn so that I don't have to feel those emotions. And, sometimes it might be the boss and sometimes it might be the partner. You forgot to take the trash out. And a sex addict can take that and run with it. So there's a way to explain that kind of stuff without pointing the finger at the person you're explaining it to in particular, because then you just trigger your partner.
Right.
But and I would suggest, and David, maybe you can chime in on this. Get a list of triggers and figure out how you're going to explain them to your partner without upsetting your partner. So take it into therapy and talk to your therapist and say, okay, phrase it this way. Don't phrase it that way. That's not going to go over, that kind of thing.
I think it's a great idea just to be, and it really makes it thoughtful. Just like we tell our addicts, you don't want to be in a situation that you haven't thought through what you're going to do if you're triggered, right? We kind of do these emergency exit plans where it's all becomes muscle memory in terms of how they're going to respond. I think in this case too, because these words are particularly sensitive and they're triggering by nature, I think it's important, the approach, because oftentimes those words need to be refined a little bit. The same thing goes for the partner, for the addict triggering the partner in terms of things they say, even well-intentioned things. I remember I had a client a couple months ago who was trying to really be empathetic with his wife, who was very traumatized by what had happened. And, he said, I could, I can understand how you could feel that way. That was like on day 4 at home. And he, how dare you think you can understand how I feel, right? It was just well-intentioned, but not the right, it didn't come off well. And so I think that's where sometimes running these phrases by a third person can really be helpful.
Yeah. So, I like the idea of sharing about triggers though, because then the partner can say, honey, you look like you might be feeling triggered, or honey, you're going to this event where you mentioned that certain things and certain people, places, things, events, whatever, might be triggering to you. Are you taking precautions? And I think that's a very reasonable question. The addict may feel like, oh, you're micromanaging me, but at the same time, maybe not. Just pose the question, or check in with something. I don't think there's anything wrong with that. But does it sound micromanaging? I didn't want it to when I.
No, I think it's good. I think it's okay.
Okay. All right. Well, all right. Is a trigger when a partner shares her feelings, which inadvertently make the addict feel shame?
Yeah, I guess that I'd call that a triggering event. Really, the trigger would be something, feeling that causes shame, I guess, and it can happen from many different people and sources. But yeah, that can certainly happen. And we found, addicts in general, I think, because of their own trauma, are highly sensitive to certain kinds of criticism, including shame and shaming, because they carry such a huge burden of shame inside themselves, and it echoes and kind of complicates it. So yeah, when that inadvertently happens, of course, it can happen. But I think it's useful to really recognize that and to talk about it when it happens and what just happened, and process it, because it doesn't have to go all the way down to the bottom of the barrel here. We can interrupt those things early on. And actually, I think it could be a really great, if I had that in couples therapy, that would be an amazing session, because we could really work on intention and communication and what just happened and all that stuff. So I think it could actually be a good thing if it were processed.
Yeah, in my every other Friday webinar with Matt Wheeler, he talks about this a lot, and how to approach a conversation like this when you preface it by saying, I'd really like to share my feelings with you. I feel that it's important, but I don't want to send you into a shame spiral and trigger you. And then you can set up some boundaries and maybe a safe word like, I'm feeling triggered. Can we take a short break or whatever? Or can we just back up and process for a second? Or so there are ways to do it. And yeah, it's two people in a relationship are inevitably going to trigger each other. If you're in a relationship and neither of you ever triggers the other one, it's going to be really boring, I would think. I don't know.
Any kind of human interaction probably will be triggering at some point. So
yeah. Oh my God, a light bulb just went off. My sex addict always said he never would allow himself to have an orgasm. It makes sense now. He didn't want the addiction episode to stop. That is exactly it.
Right. Remember, we used to think about dopamine, which is the star here with sex addiction and chemsex and porn, as the kind of the thing that made us find something pleasurable in terms of when it happened. And what we know now is we've gotten refined in our brain science. We know dopamine is all about the buildup. It's about the preoccupation. It's about the wanting more. It's what makes a porn addict who says he's going to look at porn for a few minutes before he goes to sleep. Suddenly it's 5 a.m. and he hasn't stopped. He's lost the whole night because he's gotten hooked up. And this is that flow of dopamine. It's what keeps us attached to our apps, the screens. What keeps us going for our Facebook scrolls. How many likes, how many shares. Like it keeps us going. Same thing, by the way, for slot machines in Vegas. It's the same stuff. And so when we have an orgasm, that the dopamine stops. And as Scott said, like the party's over for a sex addict. So yeah, that makes perfect sense.
Yeah, sex addicts call it the bubble or the trance. We get in a bubble, and it's this adrenaline, dopamine, oxytocin, serotonin, whatever fueled bubble where the outside world just doesn't exist anymore and time doesn't exist. And yeah, like David said, you go online for 5 minutes and suddenly it's 5 a.m. and you got to be at work in 2 hours, and you haven't slept and you stink, and and you don't know what happened to you. You sat down at 9:30 last night and you don't know how it got to be 5 a.m. You literally don't know. It's completely zoned out bubble, and there's no thoughts of negative consequences. There's no thoughts of any of this stuff that somebody who's not in this dopamine bubble, that would stop somebody. You just shut it all out, and it's a really thick bubble, and it doesn't pop very easily.
And just to drive that home, all addictions come from this kind of midbrain where dopamine is really, with other neurotransmitters, but dopamine is what it's all about. Very, very strong drives. And if you think about it, people talk about it as go messages, right? If we get triggered, like we're talking about tonight, it's really strong, like go, 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 do it, do it, do it. And at the same time with addiction, and particularly with sex addiction and chemsex and porn addiction, the pathways to our prefrontal cortex, which is like the adult in the room, right? That's where impulse control is, and our abstract thinking that says, ooh, this won't end well. Maybe I shouldn't do this, or this is really going to hurt my wife or my husband, and I don't want to do that to them. And all that stuff kind of goes offline because we are subject to that just pure drive of that midbrain. And so there's no braking system. And so it's really a dangerous situation, especially bring it back to triggers, right? We get triggered, we're getting all these go messages without much pushback in terms of not doing that. And when we're in that space, really nothing else matters. It's classic.
Yeah, it's amazing how turned off to the world we can get. And the orgasm pops the bubble. And then we're awake and realize, oh crap, did it again. Thank you both for this forum. My question is about boredom. My sex addict porn addict who is in recovery now doesn't have a lot of hobbies or other things that I think would help with boredom. TV, iPad, games, etc. are what he typically goes to, though it is getting better. If addicts don't like boredom, how come they aren't more interested in developing active, interactive, and interesting hobbies and activities? I have asked this question a million times myself, and I want to hear David's answer.
Yeah, well, a couple of things about this. I think it's a bad idea for any porn addict or sex addict or chemsex addict for that, but any intensity addict to spend too much time on a screen. And I know, most of us have to do it for work and for other things, but when we are on a screen, it's a trance state, and we're very susceptible and we're highly triggered. And so I think it's a bad idea. And especially, people that I mentioned Facebook before, Facebook, Instagram, a lot of exposed skin on those places, although they're technically, safe. So I think screen time is tricky. But the other thing about any screen time, even watching TV, it's a very passive experience. And I think it doesn't really do much to satisfy that need for involvement and activity. And then to answer the bigger question, why? I think most addicts, and this is at least my experience, never really learned how to have recreation or have fun. I didn't have much of a childhood from a play point of view, and a lot of us, get hijacked in that stuff and grow up, and addiction takes all our time. We get into recovery and suddenly don't quite know how to do recreation and fun, and it's hard. And I'll just do a shame release thing here, if you'll indulge me. When I did a postdoc clinical internship for 2 years out in Seattle, and they were so appalled at my inability to have fun. I had a therapeutic assignment to actually go to Disney World and have friggin' fun. But I was a remedial fun student, I guess. But anyway, it's hard, but it's so important because it's that outer circle stuff we've been talking about tonight. The other thing I would suggest is not just recreational activities that are isolating, but recreational activities with other people. So team sports, volleyball, or even playing tennis with somebody, doing anything with somebody else is fun. I'm trying to break out of my COVID hibernation, and there's a bunch of guys from program here that are going to be renting kayaks on a Sunday morning and going out together. I think that's fabulous. I'm going to do that. Just to, not only is it fun, but it sure beats going out by myself, and with another group of people. So I think the more we can involve other people is better, for sure.
Yeah, I'm a big fan of that. David, can you talk a little bit about the way that video games in particular and online gambling are set up to be addictive in the same way that porn is, with these sort of random payoffs?
Right. So so in psychology, there's this thing called intermittent rewards, right? Which means the reward comes, but it's not consistent. Sometimes it comes, after a while. Sometimes it's right away, but we know it's going to kind of eventually come. And I think it was Sapolsky, one of the famous neurologists, talked about the word maybe. And if the word maybe is in the equation, it's very hard for the human brain to resist. What that means is that if I'm a slot machine in Vegas, maybe I'll win, maybe I won't. But and sort of it keeps us hooked, because our brain is saying us, okay, the next one is going to be it. The next one is going to be it. That's dopamine. That's dopamine at work. And the people that write the algorithms for Vegas or for Facebook or Instagram or any of the others know this. And Facebook and Instagram want to keep you attached to their feed so that they can sell stuff. But Vegas wants to take your money, right? But it's all about that intermittent reward, that, okay, maybe something will happen this time. I think it's the same thing actually with the apps, the cruising apps, where people go on and kind of fantasize about different thumbnails and profiles and maybe reach out sometimes, and maybe there's a response, maybe there's not, but it's all an engaging kind of hook. Now, video games are the same way. The video games, and they have levels, it's very competitive, they keep you engaged, keep moving up, there's always something else to do, and it just appeals to that same psychology. And just as porn does, what's the next image going to be? Maybe it's why people stay up all night. What's next? I don't want to miss out anything. Maybe there's something else. And so it really is this engaging kind of thing that's really hard to break. I just want to point out one very interesting thing, the relationship between porn and gaming. And we're seeing this more and more, by the way, as kind of a gaming as a introduction to this kind of addictive behavior. But there was, and I should look up the game, but several years ago, there was one of the big multiplayer gaming platforms, the server went down for 3 or 4 hours. And Pornhub, which publishes a lot of data on what's happening, published this amazing spike. Everybody just seamlessly and instantly moved from this gaming platform when it went down to porn. And then when the game came back, they went back. But there's this easy transition back and forth, which tells me they're very similar dynamics in terms of the dopamine and the feed and all that. So I think gaming is a big factor that we need to pay more attention to.
Yeah, this is why it's so important, back to this question, to have some hobbies and activities, as David said, that involve other people in the flesh, in person. Get out and go kayaking, join the softball team, set up the croquet set in the backyard and play with the kids. You and your partner take the dog for a walk, and just all of this stuff. When I was new in recovery, I tried 100 different things. I was smart enough to try things that involved other people. Some of them were really fun, some of them weren't, some of them I still do, some of them I'm glad they're in the rearview mirror. But I just tried everything, trying to find things that I enjoyed and people that I enjoyed. And what it really boiled down to was people that I enjoyed much more than whatever I was doing. It doesn't matter what we're doing. We'll have fun doing anything as long as I'm with the right people. So yeah. If your partner orgasms with you, does it cause the same feelings as if he's alone masturbating to porn, causing despair? So does he feel, if he feels despair when he orgasms with porn, does he also feel despair when he orgasms with his partner?
I don't think so necessarily. I'm trying to really understand this.
I think that's what the question was asking, but you can read it differently for sure.
Yeah, I mean, masturbating for a sex addict to porn can result in despair once that bubble breaks that we've been talking about, right? That Scott was talking about, because suddenly it crashes in on what you've done. And so I guess my distinction here, and I'll apply it to this scenario, sex addiction, porn addiction, any addiction is about dropping into that bubble we've been talking about into fantasy, about disconnecting, about dissociating, kind of moving off into this other world. So, and that's when the bubble pops, there's despair because there's shame and remorse and all of that. If you're with your partner, hopefully you're not in a bubble, you're not in a fantasy, you're connected to that person. And I think it's a whole different experience. If there's an emotional connection and a physical and a sexual connection in a way, I don't see why there would be despair at an orgasm there, because ideally you're connected with that person. It's a whole different experience than it is if you're an addict, because there's so much shame and that remorse that when that bubble pops. I think it's two different things. So I wouldn't expect it to be the same in terms of the result.
I just want to pull this out of the comment feature real quick. My husband is now watching YouTube videos about guys playing video games. So his new porn is watching other people play video games, which I know that's like a thing now. I don't understand it, but I know it's a thing.
That's new to me. Okay.
Yeah. Oh yeah. Yeah. Guys commentate while they're playing the game and people watch them, or other people commentate while you're playing the game. I don't know. It's this whole thing.
Okay.
Yeah. My partner has been a sex addict since he was 9. He's been sexually anorexic our whole relationship, but has been acting out with other people throughout. I'm wondering if sexual anorexia is an effect of addiction or is it caused by sexual anorexia? What's the relationship between sex addiction and sexual anorexia, and is sexual anorexia actually a thing? Is that a term we use, or?
Yeah, I mean, sexual anorexia is a term that we do use. I think of sexual anorexia, if we do a parallel with food, eating disorders, it's a lack of, it's actually an aversion to. And so sexual anorexia would be someone who really finds sex kind of distasteful and holds off from it and abstains from it and has kind of a negative charge to it in my mind, or which refrains from it. I think what you're seeing when you have a sex addict who is anorexic, sexually anorexic in their marriage, but is acting out, I think what's going on there is that it's a common feature in sex addiction that gradually, and it's because of that escalation, again, back to dopamine, where we train our brain to kind of seek that intensity. And the addiction, whether it's through porn or acting out, gives us that extra boost of intensity that we need and eventually become dependent on to a greater, far level greater than our partner can ever provide for us. So what typically happens is that we become dependent. I'll give you an example. There's this thing out there now called pornography-induced erectile dysfunction among 20-something men, right? These young guys who are seeking erectile dysfunction drugs, and there's no reason for it. They're too young. The reason for it is because they're porn addicts and they've been looking at porn so much that they can't function with a human being because it's slower, it's intense, it's, doesn't have the control, there's more vulnerability, all that stuff that goes with a real human being that actually makes it attractive to be with a real human being. But addiction trains our brain to rely on this high intensity state. And so with these young guys, they have porn-induced erectile dysfunction with their girlfriends, but if they're looking at porn, it's not a problem. And so I would suggest in this case, I wouldn't call it anorexia during the marriage if he's actually acting out in his addiction. I'd call it just a byproduct of the addiction itself, because what that often results in is a lack of the ability to function or to be stimulated by one's partner, because our brains have been so hijacked by the addiction, often this fantasy world.
And, I also want to read into this question. This person has obviously been sexually active since the age of 9, which suggests some abuse, which could create some intimacy avoidance, which I think we see with a lot of sex addicts as well. It's harder for me to be sexual with somebody that I care about than with somebody that I don't even know their name, because this intimacy avoidance, it cranks my anxiety up for somebody I care about, for me to have to be that vulnerable. So could this be in play as well?
Absolutely. Sure, you bet. And thanks for bringing that up, because yeah, it's all about, when we talk about intimacy disorders and sex addicts, in fact, at Seeking Integrity, we really kind of frame the whole thing as intimacy disorder treatment because of just that, based on whether it's, abuse or some kind of sexual assault or neglect or whatever the causes way back when. Sometimes people have trouble being vulnerable around someone they have emotional connection with, or even trusting that person. And having sex intimacy is something obviously very intimate and vulnerable. And so there's that. It's harder if it's an anonymous person or somebody you're never going to see again. This has been true for a lot of my clients. It's much easier to function sexually than not.
Regarding boundaries, how much time is healthy to spend alone when you're an addict? I know it's good to have balance and engagement and disengagement between the external and internal world, but I'm confused at times whether I'd spend too much time alone. I go to 2 face-to-face meetings and work full-time. I also attend your meeting. I think that's quite enough people for me, but I'm not sure.
It's hard to give you a number. I think we all do require time alone. I think that's just healthy. And I make a distinction between being alone and being lonely. You can be lonely in the middle of Times Square, but you can, so around people. So lonely is kind of more of a state of mind. But I think it's important for us to have alone time just for reflection. It's really hard to say, because with the pandemic, we're also kind of so isolated and spending so much time alone. I really crave, the ability to spend more time with people out there. But in normal times, what I would try to do personally is, if I'm around too many people, it's just overwhelming. So an hour probably of, alone time would be ideal for me a day, maybe more, a little bit more. More than that, I'm starting to isolate and disconnect and avoid. And so I think you have to kind of balance. Also, what's the intention? Are you spending time by yourself with the intention of kind of meditating, reflecting, reading, thinking, or is it out of boredom? Or it's kind of what's going on is almost as important as the amount of time, I think.
Yeah, and and also personality types are very different. Extroverts and introverts need different amounts of people. Extroverts draw energy from other people. They love to be around other people. They draw energy from that. They're energized. Introverts, we lose energy to other people. I'm an introvert, but that doesn't mean I don't love people and I don't love to be around people. I do. I just love to be around them until I'm tired, and then I want to go be alone so I can recharge my battery. So yeah, there's no real answer that we can give here. If you feel like you're getting enough people time, you're probably getting enough people time. If you're not feeling lonely, if you're not feeling left out, if you're feeling supported, you're probably getting enough people time. But maybe not. I don't know. We're not there. So.
Yeah, and I don't know you, but I think if you were my client, I'd probably encourage you to go to a few more meetings a week.
Yeah, yeah. As much of an introvert as I am, I try to do something every day with other people in recovery every day for at least an hour, whether it's a meeting or going to lunch or just chatting on the phone or going over to somebody's house and having dinner or meeting a sponsee for coffee. Every day I try to do something for my recovery that also involves other people. And then I have social stuff on top of that. Um, but yeah, so two, 3 things a week, especially if you're newish. Yeah, more. You're an addict. Don't you want more? If one is great, 100 is good. They're better. Yeah. So 3 is good, but 7 is better. Just to comment. My husband tells me he plays video games so he doesn't think about porn and resent me. And when I express concern that he's suppressing his emotion, he tells me he's completely aware of his emotions when he stops playing video games. He says he has no shame, has no shadow self because he has integrated his shadow, and he has no subconscious. Says he knows exactly what motivates him. Is this denial?
Well, yeah, I think I would say so. I mean, I know some pretty evolved people in the world, and I don't think any of them would describe themselves with this level of personal evolution. So yeah, I think there's some denial there. And I think, again, when I see an addict kind of being so defensive and kind of throwing a little blame and saying, I'm fine, it worries me. So, I think, plus the video games, well, just the negativity there. So it doesn't think about porn and resent you. That's, but I think, again, I don't think video games is a great thing to do to fill time for an addict. I think it's just, as Scott, I love what Scott just said about doing something with people. I was really driving home today with our clients, the importance of connection. That is the central component of recovery is connecting to other people and learning how to do that. And it's not something that really comes naturally to a lot of us. So I think that's an important skill, but I think it's really an important lifelong kind of tool. And that overused but important phrase, right? The opposite of addiction is not sobriety, it's connection. And that's the absolute truth. Totally.
Yeah, I love this next question. On the subject of screen time, what were sex addicts like prior to the internet? Has the profile of a sex addict changed with the internet? And if so, what was it like pre-internet?
Wow, that's a great question. And I don't know that I have a completely informed answer, but I do know that as the different media has changed, right? From, magazines to videotapes to CDs to digital to online. I mean, what we're seeing is access, and I think an opportunity. As we've had smartphones where it's all private and free and confidential and easy to get, I think all those things have really been like accelerants on this epidemic, where just everybody has access to it. And so I think that there's a limiting factor in terms of just what people could access. And I see this taking off. I think, frankly, a lot of the explosion of different kinds of fetishes and kinks and different kinds of attractions and stuff is all due to people seeing stuff on the internet, stuff they never would have thought of before, frankly. And so I think it's a huge issue. I think it occurred before, just in terms of magazines and sexual acting out and certainly affairs and all that stuff. But I think right now the nature of it has changed so dramatically with digital media and with the accessibility of phones and the internet. I don't know. I think it would have been really tough. Certainly, if you look at we talk about escalation and with porn particularly, and how for a single user, as their porn career advances, right, because of the tolerance that we develop, we have to get more kind of the type of porn becomes edgier, a little rougher, kinkier, more taboo, whatever, that evolves. And I think you could see that with the evolution of porn in our culture, right? Back in the 80s and 90s, there were sort of magazines, but by today's standards, I think are pretty generic and black and or vanilla, right? And then as tapes came on, it kind of expanded some, but it was still, there was a limiting factor of just inconvenience and going and renting something. But now it's just so easy and prolific. I think that's a huge thing.
Yeah, I mean, the internet did not invent sex addiction. It just made it a whole lot more accessible. When I was 12 years old, if I wanted to look at porn, I had to, get lucky and find a discarded porn magazine somewhere, or I had to sneak into the gas station and kind of, take a 5-finger discount, which I was always too scared to do. Or maybe somebody's friend's older brother's dad had a stash somewhere, and we could look at, Playboy, which was pretty tame. And there's like 12 pictures. You get bored really quick. A 12-year-old can log on now and just type in, sex, and he's going to get 16 days worth of videos, all popping up at the same time. It's very different now. Before, if you wanted to have a hookup, you had to go to a sex club, or maybe you went and cruised a certain street corner, or
placed an ad in a magazine. Remember those?
The ads on the back of the personal ads.
Yeah.
All that stuff. Phone sex, Dr. Rob talks about when he first opened his practice, everybody was hooked on phone sex. People were spending $3,000 a month to have somebody breathe heavy at them over the phone. Some fat guy in Cleveland with a high voice was like talking dirty to, sex addicts in LA, and they were paying thousands of dollars for this, because it was the fantasy. Now we can, we got webcams, we've got hookup apps, we've got endless amounts of porn. The addiction is the same, the venue has changed. And the speed with which we access content and potential partners has gone crazy. It's not an exponential, it's exponential of exponential increase.
Right.
So I think that's the big difference. But the disease is still the same. Looks the same consequences, same misery, same everything. Just we can get it a lot faster now, and we can get it a lot younger. And we're seeing, what's changed is the demographics. Many more women and many more kids. It used to be an adult male only disease.
Yeah, I read recently the rate of women using porn is like tripling every year or something.
Yeah.
Again, I think it's more opportunity and access. And
yeah, women are like 30 to 40% somewhere in there of all porn use right now, and it was like 5% just not that long ago.
Right.
So big changes, and we can't even, it's hard to know how much kids are looking at, but surveys tell us the average age of first exposure to porn is like 11 now. So we're out of time. We've got a few questions left. I'm sorry we're not going to be able to get to them, but save them for next week. We will be here. And pay attention to your triggers. David, anything you want to say to take us out?
Yeah, just that. Don't just sit idly by and let those triggers kind of sit there. You have to actively do something with them. Move them out. Get rid of them by all means.
Okay. Well, thank you, everybody, for being here. Have a good week, and we'll see you next Wednesday.
Thanks, Scott. Good night.